Welcome, my dear undergraduate students. I hope you shall enjoy the shortcut to spotters. The time and the number are on the screen. This is a mounted specimen measuring. You are supposed to write the measurements. Length, if possible, the thickness. It is edematous or swollen and grayish brown in color. It is a tubular structure because I am able to see a lumen on one side, open at one end, and it is finger-like closed at the other end. There is another somewhat fatty structure that is attached to it. There is also a grayish-white exudate on the external surface. I hope you people have made a diagnosis. This is another specimen with the same features in which I am finding multiple interconnected vascular channels which are distended. We call it congestion. If the blood is outside, it is hemorrhage. There is an adjoining fatty tissue which is called meso. Let us see what it is. The orifice here, the yellow arrow, is narrow, and the specimen is an appendicectomy specimen. So you people will have to mention the dimensions. The diagnosis is acute appendicitis. The next one is a slide in which I am able to see a stellate lumen. Stellate means star-like. I am also able to make out some linear glands in this. There are some well-defined circular structures called lymphoid follicles. And this, of course, is the muscle externally. Well labeled over here, I am able to see an intact mucosa, lymphoid follicles, and the muscular wall. Now, what happens in our case is there is an ulceration of the mucosa. There are the mucous glands, they are absent over here. This is an ulcer. Region of the ulcer is depicted by the star. Also, throughout the thickness marked by this line, I am able to see inflammatory infiltrate, which are spot-like, multiple dots I am seeing. And in this picture, I am able to see some linear bundles. These are all the nuclei and this is the cytoplasm, bundles of smooth muscle. And crossing these bundles, I am able to find the inflammatory infiltrate. All these dots are all inflammatory infiltrate. At a higher magnification, they are having irregular nuclei, somewhat like the butterfly or a figure of 3, etc. So there is a transmural infiltrate of neutrophils in the smooth muscle as well as all the layers, and the serosa is congested. The diagnosis is acute appendicitis. This is the third spotter for us. I would like you people to kindly describe it. It is a right foot. I hope I am not caught on the wrong foot. There is an area of blackish discoloration. There is a pinkish brown viable. Viable means live. And there is a definite line of demarcation. This can be a mounted specimen kept for us in many a college. So there are areas of blackish discoloration. The skin is somewhat shrunken as though you have dried the clothes. That is called as mummified and shriveled. There is a clear line of demarcation. Here it appears viable, whereas this area is appearing blackish gray and gangrenous. The surgical margin where the surgeon has cut is viable. So it is a gross specimen of a dry gangrene foot. See you in the next 3 shortcuts.